Hello guys, welcome back to Dr. Arshad Nadeem Awan ultrasound and radiology teaching videos. Hope you're all okay, you're all enjoying your life and you're practicing radiology as well. Today I'm going to discuss about the radiopharmaceuticals or radioisotopes. These are actually slightly complex phenomena in terms of when you're doing practice and you want to know that which radioisotopes and radiopharmaceuticals will help you towards the diagnosis. So there are multiple radioisotopes we using in the clinical scenario and for the different diagnostic purpose, but there are particular radioisotopes which we are using for the particular purpose, particular diagnostic purpose, as a particular diagnostic tools. So today I'm going to discuss about the technetium pertechnetate. Technetium pertechnetate is a technetium radioisotopes and used for the diagnosis of the thyroid abnormality, stomach abnormality, colon abnormality, and the bladder abnormality. But beside this, it can also be used for certain other purposes as well. So about the technetium 99 pertechnetate, I'm going to talk about its half-life, is the physical life, and its administration, its advantages and disadvantages over other radioisotopes. So this would be a concise video for you. Hope you will benefit from it. So let's start watching these videos. Radioisotope technetium-99 pertechnetate has a physical half-life ranging from 2 years to 105 years. It has really prolonged physical half-life. As far as its biological half-life is concerned, it should be considered as 6 hours. Its decay can be done by photon emission of 140 keV. Administration can be done orally or IV contrast. So as for the dose is concerned, the dose is mentioned here, but you have to administer that if you are using the intravenous line 20 minutes prior to the imaging. So this is the standard protocol for the administration of technetium-99 for the diagnostic purpose. The uptake of radioisotope technetium-99 pertechnetate can be seen in thyroid, in salivary glands, in gastric mucosa. Especially if you want to localize the mecal diverticulum, this technetium-99 pertechnetate would be the top one to use. It can also be taken in choroid plexus, cerebral blood flow, and can also be used in gastric emptying studies. As far as its excretion is concerned, mostly it can be excreted in feces, and some of the particle of the technetium pertechnetate would be seen excreted through the urinary system as well. It should also be kept in mind that technetium-99 pertechnetate has no organification and may be almost completely discharged by perchloride. Keeping in view the advantages of the technetium-99 pertechnetate, the first and the most one is it has a low cost, can easily be afforded. It has a reduced radiation exposure with greater photon flux than iodine, which is detectability of the small thyroid lesion up to 8 mm is improved. So you can use for that purpose as well. Excellent physical characteristic of the technetium pertechnetate, that's why it's commonly used. The next is it's reduced noises in the images, because of the noise you cannot properly diagnose the thing and you may get confused. Easily collimated and easily absorbed in a very thin crystal, thus giving good spatial resolution. So its spatial resolution is quite good, and it is low cost, and it has an excellent physical characteristics. Disadvantages of the technetium-99 pertechnetate includes high neck background, and the second is the lesion with pertechnetate iodine discordance if it appears hot on technetium 99 pertechnetate, it would be cold on radioiodine. So this is one of the disadvantage. The third disadvantage is it has a poor for substernal evaluation, so you cannot do the substernal evaluation for the technetium 99 pertechnetate. Disadvantages of the 99 pertechnetate technetiums also include that it can be easily labeled with variety of useful components. For example, MDP for the bone imaging. It also labeled with the HMPAO for the cerebral imaging. It can also be labeled with DMSA or MEG3 for the renal studies, also HIDAS for the biliary studies. So as I said, that there's a multiple other variety of other useful components with whom this technetium 99 pertechnetate can be labeled, especially with the HSA for the lungs perfusion, DTPA for the aerosol in lung ventilation substances. It can also be labeled with system AB for the cardiac perfusion. So this is one of the biggest disadvantage of the technetium 99 pertechnetate, but still it is used, and keeping in view the advantages, so technetium pertechnetate is a useful radioisotope and can be confidently used for different diagnosis for the different diseases diagnosis.